Okay, so let's just talk about amputations briefly. So, removal of an extremity, so upper or lower limb. It can be from trauma, so a crushed limb that's not viable, a severed limb that's not viable, uh, severe thermal burns, peripheral vascular disease, so ischemia, say from atherosclerosis or from diabetes, where the blood supply has become so poor to the limb, typically the lower limb, that the patient is now getting ulcers and infections of the skin and possibly even the bone underneath. And the limb needs to be partially amputated. Okay? Malignancies, so cancers of the bone, such as osteosarcoma, uh, they need to, the patient needs to have an amputation to get rid of the cancer. Okay? Infection of the bone that just doesn't heal, so chronic osteomyelitis, sometimes requires an amputation because the antibiotics don't always completely get rid of, of bone infections. Okay, and then patients have to undergo a partial amputation. So the expected findings of someone who's requiring an amputation just depends on what the underlying issue is, right? So if it's from a crush injury, well, they're going to have um, very damaged tissue and fractures and likely poor blood supply to the limb. If it's from diabetes or atherosclerosis blocking an artery, well, they're going to have a pale appearing limb. They're going to have pain with walking, say, because they have a blocked artery, so they get claudication when they walk. They may have decreased sensation to the limb, especially in diabetics. They have a peripheral neuropathy, so they can often have decreased sensation. With a blocked artery, you're going to have reduced temperature because there's less blood flow getting to the extremity. The limb might look pale or cyanotic if there's a blocked artery, right? And if it's from severe atherosclerosis in the artery, sometimes the only option left is an amputation. They just can't open up the artery in all these areas that are diseased. Okay. The presence of ulcers, because there's poor blood flow to the limb, and ulcers can develop because of lack of blood supply to the skin. That can lead to infections such as cellulitis, osteomyelitis, all because of lack of blood flow. Okay. Okay, so how do we manage, even before looking at the material on this slide, how do we manage a traumatic amputation? Okay, so the big issue is if someone has an amputated arm or leg from a trauma, it's the bleeding, right? Those arteries are going to bleed and bleed and bleed until something is done. So sure, the first thing we can do is apply direct pressure with gauze to the area to try and stop the hemorrhaging. Next, we can try and elevate the limb. But if I'm going to tell you if it's an arterial bleed, it's going to continue to bleed even once we've put it over the level of the heart. Okay. So often we're going to have to put a tourniquet on the limb because the artery is just pouring blood. Okay, and a tourniquet, whether it's a blood pressure cuff that we pump up really high or a dedicated tourniquet that we just put on, and there's a device that you can twist and twist and twist to make the tourniquet super tight to block any more blood flow to the limb or the severed limb. Okay. What about the severed extremity? Well, we just put that in a dry gauze, okay, or some kind of clean cloth, and we place it in a bag, and then we submerge that bag in ice water. Okay, so we don't put the limb in the ice water. We put it in cloth, in its own bag, and then submerge it in the ice water. Okay. Okay, so what about interventions following an amputation? So a post-operative amputation. So it's going to come down to excessive bleeding, infection at the area, and pain, right? So what can we do for bleeding? Well, we can elevate the stump above the level of the heart. We can put direct pressure, and if that doesn't do it, we can put a tourniquet to stop the bleeding if it's severe enough, right? So these patients need monitoring of their vital signs. We need to assess the remaining part of the limb to make sure that there's good perfusion to the stump. So it looks nice and warm. It has good capillary refill. Okay. And of course, monitoring for infection, right? So is it red? Is it more and more painful? Does it have areas that aren't healing? Because infection of a stump can also lead to the underlying bone, right? And now you're dealing with osteomyelitis. Okay. So an amputation is done, say someone has diabetes or atherosclerosis and a blocked artery. They have to go high enough up the limb, say we're talking about the leg, to make sure that there's good remaining blood supply to the stump, right? So there has to be a decision of whether it's going to be a below knee amputation or above knee amputation, and a lot of it depends on the blood supply, right? Because if you amputate too low down and the blood supply is poor, well, the wound's not going to heal, and it's going to be at risk for infection. Okay. Now, after amputation, the limb can be left in a dependent position to try and encourage more blood flow. If it's put in an elevated position, well, that's going to make the blood or the blood flow is going to be reduced when it's in an elevated position. Okay. Frequent dressing changes, administration of antibiotics, especially if the wound was left open, so the stump was left open because of potential for infection. Often they'll close the stump. Okay, so leaving a stump open usually means they want to allow drainage to go out because there's a potential for infection. Okay. Now, in terms of pain, so we spoke about bleeding, we spoke about infection. In terms of pain, sure, there's the pain of the procedure, so incisional pain, and of course, not only incisional, but also the muscles that have been cut through, the bone that's been removed. There's the surgical pain, and then there's the phantom limb pain. Okay, and I'm going to leave that part to you. It's well explained in the book. Now, I just noticed that there's a couple of drugs that they mentioned in this phantom limb section. So calcitonin is a hormone that can be administered. It's actually made by the thyroid gland. It can encourage calcium deposition in the bone. It can reduce phantom limb pain. Beta blockers, I'm going to tell you, I've never heard of beta blockers being used for phantom limb pain, but obviously they've been studied and have been shown to have some benefit. Anti-epileptics, so we use these all the time for ongoing pain syndromes. So you might recognize some of these: gabapentin and pregabalin. Pregabalin is Lyrica, and they're used for nerve-type pain, right? So you might recognize these from someone with diabetic neuropathy that's on gabapentin or pregabalin. And they can also be used for phantom limb pain, okay? Antispasmodics such as baclofen and antidepressant medications, they they can also help with the phantom limb pain. So the antispasmodic makes sense. Antidepressants also have effects on neurotransmitters, not just in the brain, and they can modulate the pain from phantom limb, so they're also used. Okay. Um, I think that's it for the medication part. I'll leave the rest for you to take a look at. Okay. Okay, so this is what we were talking about on the slide before in terms of the post-surgical pain, so incisional pain. So opioid analgesics will definitely address that. The phantom limb pain, those opioid analgesics won't really address that kind of pain. And that's where we discussed calcitonin, briefly beta blockers, anti-epileptics, are used for all kinds of chronic pain syndromes now. We mentioned a couple of those, pregabalin and gabapentin. Antispasmodics such as baclofen, and sometimes SSRIs are used, which are antidepressants. Okay. There's also non-medication approaches, so therapies such as massage, heat, electrical stimulation, TENS, relaxation therapy. They can all be effective. Okay. So a closed amputation is where the amputation has occurred, and then they wrap the remaining skin flap and completely close over the remaining limb, right? An open amputation is where there's infection occurring. They definitely don't want to close over the remaining stump because they'll trap in the infection, so it's left open. Okay. Now they can go back weeks to months later and have a revision and have it closed. There's quite a number of different professions involved in this, so you're definitely going to have someone who deals with orthotics to fit the prosthetic properly. Physiotherapy is going to be involved for sure. A psychologist may be involved, adjusting to the fact that the patient's lost a limb. And sometimes even a social worker may need to be involved, right? For financial issues, for support, and ongoing advice where they can find that support. Okay. Okay, again, in the interest of time, I'm going to keep moving. Amputation complications, they're covered in the book a bit. So the psychological well-being, so allowing for grief, due to the lost limb. Hypovolemia, that would be more of an acute post-surgical issue. Loss of blood, infection is always a risk, especially post-surgical, once the wound's completely healed and closed. Flexion contractures can occur, and I'll leave just the advice on how to avoid flexion contractures for you to look at. Okay, so let's just do these questions at the back of chapter 69 together, sorry. So a nurse is presenting information to a group of clients at a health fair about measures to reduce the risk of amputation. Which of the following should the nurse provide? Encourage clients to stop smoking. Absolutely. So smoking leads to atherosclerosis, which causes peripheral vascular disease and reduced blood supply to a limb, in particular the leg, and that can lead to amputation. Encourage clients who have diabetes to maintain blood glucose within the expected reference range. Yeah, that's a good idea to have really good control of serum glucose, because we know that if you have tight control of your serum glucose when you're a diabetic, it reduces the chance of developing complications of diabetes, such as atherosclerosis, peripheral neuropathy, renal failure, blindness, cardiovascular disease. So B would be true. Instruct clients to unplug electrical equipment when performing repairs. Well, I guess that would be true in order to prevent a serious electrical injury to the leg or to the limb, which may require amputation. Okay. Encourage clients who have vascular disease to maintain good foot care, for sure. If you have vascular disease to a limb, that means you have poor blood supply to the limb. If you have poor blood supply to the limb and you get an ulcer or an infection of the limb, the body's going to have a really hard time healing it because the body heals through the blood. So that can turn into a raging infection that may require amputation. So good foot care is really important. Okay, so A is correct, B is correct, C is correct, D is correct. Advise clients to wait 2 hours after taking pain medication before driving. I don't really know how that pertains to this. Yeah, not really clear on that one. So A, B, C, D. Advise clients to wait 2 hours after taking pain medication before driving. There's many people out there that take medication, pain medication when driving, but usually what we advise is take the medication to see how it affects you first. So whether it's a pain medication or a sedative for anxiety or for insomnia, take the medication to see how it affects you prior to driving. Okay. Number 2, a nurse is assessing a client who has arteriosclerosis, so atherosclerosis, and is scheduled for a possible right lower extremity amputation. Which of the following are expected findings in the affected extremity? Okay, so what will a limb look like before the amputation? So, and it's already saying that they have atherosclerosis, so they have a blocked artery to the limb. So I'm expecting changes in the limb due to lack of blood supply. So skin is cool to touch from mid-calf to toes. Absolutely. Your skin has less blood supply, so it's going to be cool to touch. B, increased sensitivity to fine touch. No, your nerves shouldn't be more sensitive. In actual fact, as you have more and more blockage of arteries to the leg, you're going to have less sensation. Right? Next one, palpable pounding pedal pulses. Well, that's a really good sign. That means you have fantastic pulses when we check them at the ankle and the foot. So that's not correct. Lack of hair on lower leg. Yes. So your hair follicles are dependent on blood supply. So when you have poor blood supply to your leg, you have thin, shiny skin, less hair because it's died off, right? It's been ischemic because of the atherosclerosis. Blackened areas on several toes, absolutely. So that's ischemia, right? And that's death of tissue that can lead to gangrene, right? So the blackened areas are just dead tissue from the blocked artery. Okay, so the answer would be A, C, D, and E. Okay, so let's go on here. Number 3, a nurse is caring for a client following a below elbow amputation. Which of the following actions should the nurse take? Encourage dependent positioning of the residual limb. Yes, so we spoke about this before. So encouraging a dependent position is going to allow blood to flow to the dependent area because you're actually having gravity work on your side, right? So more blood, more healing. Inspect for presence and amount of drainage. Sure. Okay, so you always want to check to make sure that there's no signs of infection whenever there's a wound. Implement shrinkage intervention of the residual limb. Yeah, so preparing a residual limb would include this so that it can then be fitted for a prosthetic. So that would be true. Wrap the residual limb in a circular manner using gauze. I don't think that would be a good idea. So wrapping the residual limb in a circular manner using gauze. So that could, if the limb were to swell, that wouldn't allow for expansion. So that could cause reduced blood supply by doing that. That would be a good idea. Assess for feelings of body image changes, for sure. Right? This person's just had an amputation, so there's all kinds of emotional changes that can occur following amputation. So A, B, C, and E. So just leave D out. A nurse is caring for a client who had an above knee amputation. Client reports sharp stabbing type of phantom pain. Which of the following actions should the nurse take? Remove the initial pressure dressing. I don't think that's a good idea. Taking the pressure dressing out could lead to a whole new problem, which would be bleeding, right? So I don't think that would be a good idea. Encourage the use of cold therapy. I don't think cold therapy is a therapy for this. It's often heat that's used. Question whether the pain is real. We don't usually question whether someone's pain is real or not. It's their pain. So don't really see ourselves as detectives of someone's pain, right? We tend to take patients and their degree of pain as real. So that wouldn't be appropriate. Administer an anti-epileptic medication. So anti-epileptics also are able to modulate pain, and that's why they're used in, say, chronic low back pain, diabetic neuropathy, phantom limb pain. So we're in the group of medications such as gabapentin, pregabalin. Okay, so that would be the answer there. Okay, 5, a nurse is preparing a plan of care to prevent a client from developing flexion contractures following a below-knee amputation 24 hours ago. Which of the following actions should the nurse include? Limit any type of exercise to the residual limb for the first 24 hours after surgery. No, that wouldn't be a good idea. Limiting movement is rarely a good idea. B, position the client prone several times a day. Yes, that's true. You can have the patient prone to try and prevent flexion contractures. Wrap the residual limb in a figure of 8 pattern. Nope, that's not going to help prevent flexion contractions. Encourage sitting in a chair during the day. While sitting in a chair is not going to prevent flexion contractures, right? So it's more of an extension position that you would want to be in. So no, sitting in a chair all day is not going to prevent that. So 5, the answer is B there. Position the client prone several times daily.